We have three reasons we feel that the flu jab is really important. One, it protects you as a giver of healthcare, as someone that's relied upon. It's a way of looking after yourself. Second thing is it protects your family. You're not taking home germs that you would otherwise leave behind if you've had the flu jab. And thirdly, it protects your patients, those who are the most vulnerable. The key drivers for change and for improving the uptake of the flu vaccine were very simple here. For 2 weeks of the year, we had 50% of all the deaths from swine flu in England. And we noticed, as we did nationally, that largely it was 20 to 30-year-olds, particularly females, and even more so if you were pregnant. We also, coupled with that, had a member of staff who died from the flu, contracted from a patient. That two things sent shockwaves through the organisation, and we realised how important it is to keep staff safe and also to keep our patients safe. Last year, up until the first 2 weeks in December, our uptake of flu was only about 25%. By the end of December, we were up to 70%. And we're projecting that we'll be in excess of 70% this year.
The idea for flu volunteer helpers came in the Occupational Health Services Manager's pandemic flu document in 2008. The purpose of that was that if we did need to vaccinate large numbers of staff within a short period of time, we would have the help available to us.
We've addressed the challenges that we face by, firstly, clinical leadership. We've put our doctors and nurses at the heart of the decision making in our health groups, and we've said to them, you have to make sure you look after your patients and personally have to lead this and be seen yourself to be a role model for this. That was really important. I think we've also highlighted quite well around the trust through our communications team the impact it has on a team when a member of staff dies from contracting something that was easily preventable. And thirdly, we've really emphasised to staff their moral obligation to look after patients. So, for example, in maternity, you have to have your BCG before you're allowed to practice. And we've said that's a very similar example to dealing with very vulnerable people, making sure that you protect them by having your flu jab.
We offered a range of alternatives for them to have their vaccine. For example, having appointment sessions within the occupational health departments, both here at Hull Royal Infirmary and our other main site, Castle Hill, as well as having a number of drop-in sessions to the department and offering drop-in sessions in the main tower block, in the dining room, then looking at visiting the wards, doing drop-in sessions to each of the wards and units within the hospital to relieve people so they didn't have to actually leave the workplaces to have the vaccine. We appreciate the help and support of our flu volunteer helpers. We believe that it will make the vaccine more readily accessible to employees, and it will save time when the demands on frontline workers' time is very high and very valuable, and it saves employees leaving their workplace. Our helpers are easily recognisable. We have a badge that the helpers wear, which employees will easily recognise, and they can ask their vaccinators for a vaccine that will take 5 minutes in their workplace.
I was asked to be a volunteer vaccinator last year by the Occupational Health Department to support them with vaccinating midwives within maternity services here. And as being part of the public health team, I did see it as my wider role to support colleagues with them getting the flu vaccination because of, I knew about the clinical commitments that they have. And I thought maybe because I'm visible and in the areas, I thought it would be a good idea because they'd be able to access me for the vaccines more readily, really.
I think the ease of access is a big consideration, and having been a community midwife and finding it difficult to come in to access strict sort of office hours, having a flexibility of evenings and nights and weekends makes a massive difference for people taking up the offer of a vaccination.
We have a number of clinical conferences each year, which I have a consultant conference, and we highlighted to our consultants their critical role in leadership, that people will look to them and that they have to lead by example. We have a team talk each month where we set all the clinical leaders and the staff leaders together, and we talk through together our strategy for flu and got them to sign up to our suggestions. And then we simply made it easy for people to get the jab. So we empowered our clinicians who are giving the jab to go out and to vaccinate people. They have badges that say, I'm a vaccinator, ask me for your vaccination. They're going to where the people are rather than making the people come to them.
I feel Staff did take up the flu vaccine more because I communicated the information to them, because there was colleagues who had said they didn't feel very well after vaccination previous years. So I was able to reassure them that the vaccine is not a live vaccine, so there isn't any, they wouldn't get any flu symptoms from that vaccine. So I could reassure them on that score, and that the vaccine is sort of very refined now, and you know, there isn't any, you know, any symptoms they do get, they can't really relate that to the vaccine.
So what we've introduced as a trial for this year is what we're calling a flu day. So if staff register before the 30th of November this year, they will be entitled to take an extra day's annual leave in the early part of next year, between April and September when it's quieter. They'll get a little slip of paper that says, I've had my flu jab. Their manager will give them an extra day's annual leave. It's two things. It's a thank you for doing the right thing, and it's also an incentive to say, yeah, there is a little bit for you in all of this. And actually economically makes a huge amount of sense. Normally if someone's off sick with flu, it's 3 to 5 days. So by giving somebody 1 day's annual leave, protecting 3 to 4 or 5 days of sickness makes economic sense. And it's a good thing to do.
What actually motivated me to have the flu jab was for my own protection and to also protect the women and children that I care for. Having the flu jab, I think, is important because of the women and babies that we care for, to ensure that we don't obviously pass the flu virus onto those people. And secondly, from a personal perspective as well, so that I don't contract the flu virus and pass that to my family and friends.
We don't just want to survive as an organisation, we want to thrive. We want to be seen as a place to come and work, somewhere that cares for its staff, somewhere where care is excellent. That will give us a great future. So even this small part of encouraging people to get the flu jab, it's all a part of that greater vision of great staff, great care, great future.